Hi everybody. So in this presentation I will talk about emotional regulation. This information was created for educational purposes only. It was not created to inquire therapy-related services or provide diagnosis. If you feel that any of this information being discussed relates to your child and creates concern, please contact your healthcare provider. In this presentation, I will discuss what self-regulation is, emotional regulation, the importance of emotional regulation, what do these challenges look like in children, how can occupational therapy help, and how can we support these skills. First, we have self-regulation. This is a person's ability to adjust their level of alertness and how they display their emotions through their behavior. This includes regulating one's sensory needs, emotions, and impulses to meet the demands of the environment, reach one's goals, and behave in a socially appropriate way. The first area within self-regulation is sensory regulation. So this allows a child to use cognitive processes necessary for problem solving and related abilities in order to demonstrate attention and persistence to task. Next is executive functioning, or also cognitive regulation. This allows a child to maintain an appropriate level of alertness in order to respond appropriately across environments to the sensory stimuli. And lastly, we have emotional regulation. This allows the child to respond to social rules with a range of emotions through initiating, inhibiting, and modulating their behavior in each situation to ensure social acceptance. Our ability to self-regulate depends on the effectiveness of these three areas. If one is not functioning appropriately, the person's ability to self-regulate will be decreased. Developmentally, a child will go through different stages of self-regulation. This can be seen starting at 12 to 18 months. This is when the children become aware of social demands and develop the ability to change their behavior when the parent asks. In most cases, this early step in self-control requires an adult to be nearby and direct the behavior. By 2 years of age, this ability improves to the point where children start to develop self-control, or the ability to follow others' behavioral guidelines more often even when mom and dad aren't around. Then by 3 years old, most children can generalize self-regulation strategies used from previous experiences. In other words, children will act in ways that reflect how they think their mom and dad would want them to act in different situations. So what is emotional regulation? So emotional regulation refers to the process by which individuals influence which emotions they have, when they have them, how they experience and express their feelings. Emotional regulation can be automatic or controlled, conscious or unconscious, and may have effects at one or more points in the emotion-producing process. Emotional regulation allows children to respond to social rules with a range of emotions through initiating, inhibiting, or modulating their behavior to ensure social acceptance. Initiating actions is the ability to be proactive or take initiative to achieve greater results beyond what is required. Inhibiting actions is to suppress or restrain a behavioral process. Modulating responses is the effort to modify an emotion after it has already been generated. Emotional regulation means being able to think constructively about how to cope with feelings. We want children to have their feelings, but not be overwhelmed by them, to feel discouraged but not give up, to feel anxious but not stay at home, and to be excited but not get so carried away in their enthusiasm that they use poor judgment in making decisions. So why is emotional regulation important? So it's a necessity for academic, social, and moral development in children. It assists with regulating emotions, paying attention, work performance, resolving conflict with peers, problem solving, enriching relationships, and the overall health and well-being of the child. Here are some signs of emotional dysregulation. Many children we observe and meet in school are not able to identify or differentiate between different sensations, states, and feelings, and will not know how to move between one state and another or recognize the need to do so. As a result, they are not in the position to be able to self-calm. They may be grumpy, irritable, anxious, nervous, worried, sad, fatigued, or have a feeling of low energy. They may be loud, aggressive, or have the inability to concentrate and stay focused. They may be on edge and highly sensitive, provoking an emotional response such as aggression, tearful, or feeling of hopelessness and vulnerability. They may remove oneself from a situation either by running or fighting, being the only strategies. They may have cognitive distortions or biases, including it's not fair, I am stupid, everybody hates me, I'm bad at everything, and they may have a limited experience of being in the state of a calm. Occupational therapists can also address difficulties with emotional regulation. In children, emotional regulation issues are often seen as behavior problems. All children have tantrums from time to time, but children with emotional regulation issues often tantrum more frequently and for a longer period of time. Occupational therapists problem solve with parents to improve their child's self-calming abilities by working on sensory-based issues underlying emotional dysregulation and providing parents with strategies to handle and prevent excessive emotional outbursts. Some of these strategies can include using fidget toys or stress balls, deep breathing exercises, short bursts of exercise or physical activities, and many, many more. Occupational therapists can also utilize interventions such as the zones of regulations, the incredible 5-point scale, social thinking program, and how does your engine run. The aim in supporting emotional regulation is to support the child to have increased self-awareness, develop self-esteem and highlight success, recognize and learn a language about feelings and states, and begin to relate these to situations, help the child recognize what they are feeling, process why they are feeling a specific way, and develop their ability to control their feelings of others and be more aware of their needs and feelings. They have more experience of what it is to be calm and relaxed and create ways to effectively express feelings in a constructive manner. By teaching children how to recognize their stressors and introduce strategies to manage their responses and behaviors, kids learn to master the skill of self-regulation and are better equipped to learn, grow, and succeed at home, in the classroom, and within the daily activities that are meaningful to them and their families. Lastly are strategies to support emotional regulation. Get to know the child well and build a trusting and secure relationship. Be predictable and level in your responses. Consciously and actively listen without judgment or comment. Validate the child's emotion. Teach them that emotions are normal and that they can be in control of how they deal with them. Model good emotional behavior. Describe your own feelings and demonstrate what you do to calm yourself. Comment when you see that the child is calm, settled, and in control. Encourage them to recognize and be mindful of how they feel in these instances, and because they may occur infrequently. Identify that the child's specific anxiety triggers and actively intervene at the earliest opportunity to reduce this anxiety. Name the emotions as the child is experiencing them, or use a visual aid to allow them to consciously analyze their own emotions. When teaching about emotions, this should happen when the child is in a state of calm and more receptive to learn. Look at books and magazines and discuss what a person might be feeling and why they may be feeling a certain way. Give them simple scripts to explain what they're feeling and to whom. Here are some activities that support emotional regulation. Many of these include breathing and sensory techniques because they help a child slow their heart rate and calm their body to be able to communicate effectively. The first one is tummy elevator game. This is where you place a stuffed animal on the child's stomach to see how far their breath can push the animal up the elevator and back down. Next is volcano breath. So have the child take a deep breath in while pushing both hands together in front of their heart. Have them exhale deeply and bring the folded hands over the head and out to the side, as if the volcano was erupting. You can also utilize social stories. These provide a framework and guidelines of what behavior could be acceptable in a given situation. So there's different social stories out there, including when I feel angry, feeling frustrated, and worrying. You can also use chewable jewelry. So if your child seeks oral input where they're chewing on their shirt all the time, they're chewing on their hair, or they have something in their mouth, give them something that they're allowed to chew on. So they make necklaces, bracelets, and many different things that a child can use and have a specific item that they can chew on. You can also do straw and ping pong ball. So this is utilizing that deep breath and having them blow through the straw at the ping pong ball to move it across the table or ground from start to finish. Lastly is a chill out corner. So create an area where the child can go to calm down, and it's a safe place where they can utilize any tools or sensory supports that they may need to help calm their body. That is all I have for emotional regulation. Thank you for watching. If you have any questions, please reach out.